Our next presenter is Mary Holland. She's a research scholar at New York University School of Law. Ms. Holland, you have the floor.
Thank you very much. It's an honor to be here. I want to start by asking a couple simple questions to be answered by a show of hands. How many of you have ever, for any reason, been critical of the United Nations? Security Council, peacekeepers, budget issues come to mind. I see a lot of hands. Okay. And how many of you have ever been critical of the United States for any reason? Foreign policy, domestic policy, role in the primary elections, right? So we're here at the UN, we're in the United States, but the vast majority of us have been critical of these institutions at one time or another. To me, this is like asking, are you alive? Are you breathing? Are you a thinking person? It is human and normal to be critical. Almost all of us have been critical at some point because these are complex institutions with varying actions and inactions all the time. But now, if I ask you, have you ever been critical of your country's vaccine policies? You may be reluctant to raise your hand, and for good reason, because in the supercharged public discourse about vaccines, were you to answer, yes, I have been critical of some aspect of vaccine policy at some time, you would likely be branded anti-vaccine, that fundamentalist boogeyman term, and not by a militant or fringe publication or spokesperson. You might be branded anti-vaccine by the likes of the New York Times, the New England Journal of Medicine, the World Health Organization, and by spokespeople from National Centers for Disease Control and National Pediatric Associations. Your views on vaccines might be considered outside the mainstream and equivalent to the views of those who deny climate change. You might be considered, as I have sometimes been, a flat earther. No matter if your critiques were categorical or that you truly oppose all vaccines for all people at all times, or if you simply believe, as many people here and I do, that mercury should never be a preservative in any vaccine anywhere in the world because there are better and safer alternatives. Many in this, thank you. Many in this audience here today are branded anti-vaccine, although that is a gross distortion. We are called this primarily to marginalize and dismiss our views. But just as most of you are critical of some aspects of the UN and of the US, but think that they are important institutions, most of us have views that are nuanced, pro-health, and pro-safe, affordable, necessary, and effective vaccines, or sane vaccines. So my focus today is on the role of law in protecting human rights when it comes to vaccines. How can we balance the rights of the collective versus the rights of the individual? Vaccines, by their very nature, are a population-based medical intervention. If enough people take this medical intervention, then the so-called herd will be protected from the circulation of a communicable disease based on the theory of herd immunity. Although individuals receive vaccines, the rationale for vaccines is for the good of the individual and the society. One of the core purposes of the United Nations, set forth in Article 1 of its charter, is to achieve international cooperation in promoting and encouraging respect for human rights and for fundamental freedoms of all. So the UN and the international community have obligations to respect human rights related to vaccination. But how must nations in the UN do this? This is an important question that deserves scrutiny as it profoundly affects both individual and public health. Since World War II, the international community has recognized the grave dangers in involuntary scientific and medical experimentation on human subjects. In the aftermath of Nazi medical atrocities, the world affirmed the Nuremberg Code, which stated that the voluntary consent of human subjects is absolutely essential. The International Covenant on Civil and Political Rights further enshrined this prohibition against involuntary experimentation, stating, "No one shall be subjected without his free consent to medical or scientific experimentation." Such a prohibition is now universally recognized, so that some courts and scholars have pronounced the right to informed consent as a matter of customary international law. In other words, it applies everywhere, whether or not a country has it on its books. And it's the same as the norms prohibiting slavery, genocide, torture, and piracy. But what about informed consent in the area of treatment, including preventive treatments like vaccines? This is a controversial issue today in many countries, including the United States. In 2005, the UN Educational, Scientific, and Cultural Organization, UNESCO, addressed this issue, adopting the Universal Declaration on Bioethics and Human Rights based on a consensus of 193 countries, including the United States. The participating countries hoped that this declaration, like the Universal Declaration of Human Rights before it, would become a set of guiding principles. On the issue of consent, the declaration states, any preventive medical intervention is only to be carried out with the prior, free, and informed consent of the person concerned, based on adequate information. It further notes that the sole interest of science or society is not sufficient. This pronouncement is the extension of the medical oath attributed to Hippocrates 2,500 years ago, that doctors must work for the good of their patients and never do harm. Abbreviated as the first do no harm principle, this credo embodies the precautionary principle in medicine, clearly placing the interests of individual patients above the interests of the collective or so-called herd. This precautionary principle leads directly to the view that vaccination policies must be recommended, not coerced. The doctor-patient relationship depends first and foremost on trust, and coercion undermines it. When the doctor-patient relationship is based on coercion, trust is a casualty, and doctors then serve the state, and by extension the society, above their individual patients. This is a slippery slope where civilized medicine has too often derailed in the past. Dr. Leo Alexander, the chief U.S. medical consultant to the Nuremberg trials, warned in 1949 that from small beginnings, the values of an entire society may be subverted. He pointed out that long before Nazis came to power in Germany, a cultural shift in the medical community had, quote, already paved the way for adoption of a utilitarian, Hegelian point of view, with literature on the euthanasia and extermination of those with disabilities as early as 1931. Following the medical precautionary principle, the default position for vaccination must be recommendations, not compulsion. Individuals, for themselves and their minor children, should have the right to accept or refuse the preventive medical interventions based on adequate information and without coercion, such as the threat of loss of economic or educational benefits. Informed consent must be the default position because compulsion on its face not only undermines trust, but limits the fundamental rights to life, liberty, bodily integrity, informed consent, privacy, and parental decision-making. Many developed countries' vaccination policies embody this principle of childhood vaccination recommendations, including conference co-sponsors Germany and Japan. Other developed countries that achieve impressive public health without resort to compulsion include the United Kingdom, Australia, Austria, Denmark, Iceland, the Netherlands, New Zealand, Sweden, Norway, Finland, Denmark, South Korea, and Spain, among others. Nonetheless, the Universal Declaration on Bioethics and Human Rights does permit limitations of fundamental rights, but these limits must be imposed by law and must be, quote, for the protection of public health or the protection of the rights and freedoms of others. Furthermore, any such law needs to be consistent with international human rights law. International courts have developed a test to assess whether restrictions of fundamental rights are legitimate and lawful. The test studies whether a measure is lawful, strictly necessary, and proportionate to the risk. The state enacting the restriction bears the burden of proof that the compulsory medical intervention is lawful, strictly necessary, and proportionate. Generally, strict necessity must be the least restrictive alternative to achieve the public health objective, and non-coercive approaches must be considered first. Thus, the state must show that a less restrictive alternative is not feasible before adopting a highly restrictive or coercive one. In addition to these criteria, if a state does mandate vaccination, then it has an affirmative obligation to provide an effective remedy for those who have been injured as a result. Like all prescription drugs, vaccines carry the risk of injury and death to some. The guarantee of an effective remedy is a basic pillar of the rule of law in a democratic society, and the remedy must actually be an effective one. It can't be an illusory remedy, which in fact provides no relief.